I'll take this hat off, sorry. My name's Evan Minty. I'm a general internist. I work out of the University of Calgary. I co-lead this group with Jenny Lane, who is a orthopedic surgeon out of England, who's currently on maternity leave. Our broader mission in this surgery and perioperative work group is to collaboratively generate the observational health evidence needed to better understand the role of surgical and perioperative interventions in medical care. There's millions of surgeries performed worldwide. The crude mortality after surgery is 0.5 to 5%. Complication rates are around 25%, and in industrialized countries, it's felt that 50% of those are preventable, and it is very much understudied in an observational health data context. So very much a greenfield area. And as an additional appeal to those of you who are pure data scientists, it's also a very nice setup based on the timeline below for an observational data science problem. So we're interested in surgeries that we think are more reliably appear as covariates in observational records, and a very limited time at risk afterwards, over which bad things can happen, and how we can use that window to study surgical processes and interventions and better care for surgical patients, I think is something that has a real greenfield opportunity. Our meetings are the last Wednesday of every month, so including tomorrow. Tomorrow we'll be discussing some things around the existing study that we're working on as part of Dry January. Next slide. In terms of our broader objectives and key results, our anticipated key results for the year, and under the theme of evidence-driven data standardization, we're really lucky to be working with the vocabulary team, including Oleg, Zook, and Masha, and others. One of our objectives there is to convert existing surgical cohort assets that are ICD-9 or non-standard concept set based to standard concepts, with validation both through peer review and through population level methods. That's something that's underway right now as part of this study. An additional objective in this theme is to improve the vocabulary mappings in the procedural domain in partnership with that vocabulary team through both LLM enhanced methods and manual review of some of these code lists. Under the theme of guideline-driven evidence generation and dissemination, we want to refine, improve, and disseminate our surgical and outcome cohorts. Key results here will be the completion of those translations to standard vocabulary space and submitted updates to the phenotype library. And we want to complete at least one phenotype description as a paper. Additionally, under this theme, we want to complete a surgery incidence rate study. We've been really lucky to have had the leadership of George Ripsacks and Cindy Chen and others at Columbia in terms of the how often study design. Chris Knowles and Geltham and Aza also did a lot of heavy lifting in that study that we're benefiting from. And so we would like to complete the execution of a study of that type and publish at least 2 papers from it. We want to create a specification and plan at least one surgery-related effect estimation or prediction network study, with a key result of having that some of the building blocks for that study ready by January 2026. Next slide. Finally, under this theme, we want to improve the engagement with the surgery and perioperative medicine clinical community, largely through acceptance of this type of work to conferences in that broader community, one of which we'd like to see as a presentation of the broader OHDSI mission, capabilities, and methods. And we want to involve at least 3 new members from at least 3 new surgery perioperative focused research groups. We made this OKR last year, but we want to expand it and keep growing our group. Finally, under the theme of collaborative education, we'd also like to promote more cross workgroup collaboration through collaborations with other work groups. We have a lot of patients in common with other clinical work groups and a lot of methodology interests in common with other methodological work groups. And so we'd like to see 2 joint meetings in 2025. Next slide. So if you have any questions or interest, there's my email address. You can also join on Teams as others have indicated. And again, tomorrow will be a great day to make an introduction and see where we're at with the incidence rate study that we're working on.